mental health, mild cognitive impairment, dementia and Alzheimer's disease, and healthy aging. Why is mental and cognitive health important when aging? Objectives for this lesson are to comprehend the impact of mental and emotional health on aging, and to examine mild cognitive impairment, dementia, and Alzheimer's disease, which occurs in the aging population. Mental health and aging: depression, anxiety, and loneliness. Depression is more than just feeling sad or blue. It's a common but serious mood disorder that needs treatment. It causes several symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, and working. Depression is a common problem among older adults, but is not a normal part of aging. In fact, studies show that most older adults feel satisfied with their lives, despite having more illnesses or physical problems. However, important life changes that happen as we get older may cause feelings of uneasiness, stress, and sadness. Preventing depression is key. Preparing for major changes in life, such as retirement or moving away from your home of many years, or staying in touch with family. Let someone know when you feel sad. Regular exercise may also help prevent depression or lift your mood if you are depressed. Pick something you like to do. Being physically fit and eating a balanced diet may help avoid depression that can bring on disability. Anxiety is also important. It may affect twice as many older adults as depression, according to new research. Generalized anxiety disorder, GAD, may be the most common mental disorder among the elderly. Generalized anxiety disorder is more common in elderly, affecting 7% of seniors. Anxiety can have a serious impact on quality of life. Ways to control anxiety are to control your breathing, get some sunshine, feel a comforting touch, talk to a trusted confidant, do physical activity, or listen to calming music. There's also loneliness and social isolation. Human beings are social creatures. Our connections to others helps us to survive and thrive. Yet as people age, many are alone more often than when younger, leaving them vulnerable to social isolation and loneliness, and related health problems such as cognitive decline, depression, and heart disease. Fortunately, there are ways to counteract these negative effects. You need to explore transportation options and investigate local senior organizations and activities, or maybe consider adult daycare. Use of social media to connect is very helpful, and engaging in frequent video chats like FaceTime is also known to reduce loneliness and social isolation. There are many senior activities in most communities, and that's a good way to engage someone. In sum, depression, anxiety, and loneliness can all impact the mental and emotional health of the aging adult and are important to address. So what about dementia? What can be done to reduce the risk of cognitive impairment in dementia and Alzheimer's disease, and what is it exactly? All people forget things from time to time, regardless of our age. As a person gets older, memory works differently, and from time to time, a person may forget something. This is common and normal. Dementia is not a normal part of aging. It is a disease of the brain. As you can see, forgetfulness is normal. It refers to memory only. But dementia is abnormal and it's forgetful. The normal is it does not disturb our daily life. It's about details of some event if you're forgetful. And it's information on the tip of your tongue but comes back eventually. And it doesn't prevent the brain storing new information. But if it's abnormal and you have dementia, you're forgetful, lose control of your life, your memory loss is severe enough to interfere with the ability to function properly, and you have impaired abstract thinking, judgment, and use of language. and inability to perform complex physical tasks or to recognize objects or people. There's a pretty high rate of occurrence in the US of dementia, with 5.7 million people living with it. Alzheimer's disease accounts for about 60 to 70% of these types of dementia. And these numbers are expected to rise as life expectancy increases and projected to be at 13.8 million by 2050. Regarding risk factors for dementia, 10% is genetics, and 30 to 60% is genetically influenced by inherent genes living longer and getting dementia. And of note is that Hispanics and African Americans are more likely to have dementia. Here's the 10 warning signs of dementia. Memory loss, which is the most common, that disrupts daily life. It's especially forgetting learned information. Others include forgetting important dates or events, asking for the same information over and over, increasingly need to rely on memory aids or family members for things that you need to handle on your own. Then there's challenges in planning or solving problems. Doing ordinary things like hobbies and money matters are more difficult. And also, activities that should be done in a certain order, such as traveling or preparing a meal, are hard to do. And then there's difficulty completing familiar tasks at home or at work. Finding it hard to complete daily tasks or having trouble driving to a familiar location, managing a budget at work, or remembering the rules of a favorite game. And then there's confusion with time or place. You lose track of dates, seasons, and the passage of time, or you're having trouble understanding something if it is not happening immediately, or forgetting where you are and how you got there. And then there's trouble understanding visual images and spatial relationships. For some people, having vision problems, or difficulty reading, judging distance, determining color or contrast, or you may not recognize yourself in a mirror. Then there's problems with words and speaking and writing. Trouble following or joining a conversation, stopping in the middle of a conversation and having no idea how to continue, or you may repeat yourself. Or problems finding the right words or calling things the wrong name. Then there's misplacing things and losing the ability to retrace steps. You may put things down in unusual places, lose things and be unable to go back over your steps to find them again, or may accuse others of stealing, and it occurs more frequently over time. Then there's decreased or poor judgment. Changes in judgment or decision making. For example, use poor judgment when dealing with money, give large amounts to a street musician, or ordering things they cannot pay for, or paying less attention to grooming or keeping to themselves clean. Then there's withdrawal from work or social activities, giving up hobbies, social activities, work projects, or sports. Having trouble keeping up with favorite sports teams or remembering how to complete a favorite hobby, or avoiding being social because of changes that have been experienced, and they think that if they do nothing, nothing can go wrong. And finally, the 10th one is changes in mood and personality. You can become confused, suspicious, depressed, or anxious, and may be easily upset at home, at work, with friends, or in places where they're out of their comfort zone. These are the 10 warning signs of dementia. In total, there are 8 different types of dementia. Alzheimer's disease is the most commonly understood and known. But there's also vascular dementia, dementia with Lewy bodies, mixed dementia, frontotemporal lobal degeneration, Parkinson's disease, Creutzfeldt-Jacobs disease, and normal pressure hydrocephalus. There's preclinical and pre-symptomatic stage of cognitive changes. Physical conditions connected to dementia exist in the body before symptoms are evident. Currently, only defined in the research or setting or clinical trials, and it's unlikely to be given an official diagnosis, but treatment should still begin. Then there's the prodromal stage, where mild cognitive impairment occurs. between normal age-related memory loss and dementia. There's persistent memory problems, like with name recollection, difficulty following conversations, marked forgetfulness, and able to perform routine activities without assistance. Mild cognitive impairment often leads to Alzheimer's disease, but not all of the time. Stage 1 is mild. It's a loss of energy and spontaneity, though no one notices anything unusual. They exhibit minor memory loss and mood swings, and they're slow to learn and react. After a while, they start to shy away from anything new and prefer familiar things. They're able to perform basic tasks independently, but may need assistance with more complicated activities. Speech and understanding become slower, and they lose their train of thought mid-sentence. And sometimes they get lost while traveling and forget to pay the bills. As they become aware of loss of control, they can become depressed, fearful, irritable, and restless. That is stage 1, mild dementia. Where stage 2 is moderate, they eventually begin to be disabled. They're able to recall distant past. Recent events become difficult to remember. It affects the ability to comprehend location, day, and time, and caregivers must give clear instructions and repeat often. As the mind slips away, they invent words and do not recognize familiar faces. This is moderate stage of dementia. And then a severe stage of dementia is the final stage, and they become more and more unresponsive. Memory becomes so poor that no one's recognizable, and they lose bowel and bladder control and need constant care. They also lose the ability to chew and swallow and become bedridden, and they're vulnerable to pneumonia, infection, and other illnesses. Respiratory problems worsen when they're bedridden, and it often leads to coma and death. That's a summary of the 5 stages of dementia. But there are things that we can do for risk reduction. The first is to prevent head trauma. Traumatic brain injury risk remains for years after the original injury. We can prevent this by using seatbelts, helmets when biking, and using fall prevention strategies. You can also promote heart health. There's a close link between heart health and brain health. You can modify your cardiovascular risk by quitting smoking, having a healthy diet, and doing physical activity on a regular basis. There's also avoidance management. So you prevent the onset of or manage conditions that can increase risk, like high blood pressure, diabetes, and midlife obesity. By preventing those 3 illnesses, it will reduce your risk of getting dementia. You can also keep your brain active. You can learn new information and skills, volunteer, read, or play challenging games. Social connectedness, friends, social groups, and volunteering are also key to keeping your brain active. In sum, understanding the disease and how it impacts the person with the disease and their family is the first step in designing comprehensive care to enhance the quality of life for all concerned. Dementia is a key part of aging, and to do healthy aging, you need to know how to treat the disease. In summary, to promote healthy aging, awareness of emotional and cognitive health is needed. Thank you.